My name is Alejandro Rodriguez. I'm a urologist with Central Maryland Urology, and I practice at Howard County General. The vasectomy procedure is a surgical procedure done for male sterilization. It is considered a permanent means of birth control. The vasectomy procedure is typically done under a local anesthetic. It involves anesthetizing the vas deferens, which is the tube that the sperm travel through. That's brought up to the skin just literally by touch and mobilizing the skin. After the skin is locally anesthetized, a small incision is made and the tube is brought out through that incision. A small section of the tube is taken, the tube is clamped, and then put back into the scrotal sac, and the incision is closed with an absorbable suture. Typically, the procedure can be done either through 1 or 2 incisions. So typically I tell men, as far as doing the procedure under a local anesthetic, which is the way most of them are done, they'll be quite comfortable, but they do always have the option of doing it under sedation as well, which for some men who have trouble with getting blood drawn, the slightest thing makes them pass out, that's a great option. And the other reason we might do it under sedation is if during the examination we discover that it's difficult to find the vas deferens, it's hard to mobilize, and there's usually a consultation before we actually do the procedure. So typically the recovery after a vasectomy is 1 to 2 days of rest at home. An ice pack is advised over the scrotal area, and then within a week a man can resume his normal activities, but I advise him to take a week off of any exercise or sexual activity. So the risk of a vasectomy, like any surgical procedure, would be bleeding and infection. The chances of having bleeding or infection that would require another operation is less than 1%. The other risk unique to the vasectomy procedure itself is if the procedure failed. The term is known as recanalization, where the tube were to fuse back together and sperm start traveling through it. That's also less than 1% chance of that occurring. For the vasectomy, we advise men to, again, abstain from sex for 1 week, and then once they start engaging in normal sexual activity, they need to use birth control because they're still considered fertile. We typically tell them to have between 20 and 30 ejaculations before they provide a sample to the lab that'll be tested to see if there's any viable sperm. If there are viable sperm, they repeat the sample after 10 to 15 more ejaculations. Most insurance cover a vasectomy procedure. They've never shown any correlation between vasectomy procedure and it causing prostate cancer or testicular cancer. There's no increased risk of having sexual dysfunction after the procedure. A man's ejaculate remains essentially the same, except for the fact that it doesn't contain sperm in it after the procedure. And in terms of sexual function, men are very concerned that it's going to affect their testosterone level or their sex drive, and vasectomy procedure does not do that. It only interrupts the flow of sperm, not testosterone, which travels through the bloodstream. The vasectomy procedure is reversible. The success rates of a reversal depend on the length of time since the vasectomy. It also depends on the experience of the surgeon doing the reversal procedure. They've reported in the literature that pregnancy rates after vasectomy reversal are around 50%. So it's not a 100% guarantee that it'll work after a reversal.